This conference will now be recorded.
Well, we've got two of our participants signed in, so why don't we get going? So, Margot, if you want to lead things off.
Good morning, everyone. Again, just for the record, I'm Margot Lalich. I'm the Interim Director of Public Health for Clatsop County. I'm not going to focus on specific numbers because I think what's most important and most concerning is the trend that we're seeing in terms of the number of infections and also the number of outbreaks. We have a lot of outbreaks in our community. We are not unique. We're seeing this across Oregon. What is most concerning, though, about those outbreaks are that they're affecting the vulnerable populations. We have outbreaks in school-age populations. We have outbreaks in clinical settings. We have outbreaks in very vulnerable populations, as well as work sites. And so what we know about the vaccine is that it's not 100% protected, meaning it doesn't prevent any one of us from becoming ill. And we're learning more as we see the mutations of the variant. What it does is protect us from becoming severely ill or hopefully ending up hospitalized or even worse. So in our focus now at this point with public health is not containment. That was a priority at one point in time. We can't contain it at this point in time. And certainly between the opening up of Oregon and then the emergence of the Delta variant, it's just simply not feasible. So what we're trying to do is educate, vaccinate, and protect the most vulnerable. So our highest priority remains vaccination, and we continue our same strategy, and that is to vaccinate those who are unvaccinated, to educate those who are hesitant about being vaccinated. We continue to do direct outreach to employers. We also continue to vaccinate those who have not been vaccinated, who are homebound. And of course, with school returning soon, we are working with our school districts to vaccinate those eligible within the school age population who have not yet been vaccinated, and their family members if they so choose. We have a whole team working on, just in partnership actually with the Oregon Health Authority. They're providing a lot of support to counties right now around case investigation, contact tracing, and the outbreak management. It's really the forensics of communicable disease investigation. And so we're focusing on the case investigation because that helps identify the cases and their link to potentially vulnerable populations that need to be protected. In terms of case management, part of that is notification, but a big part of case management is, and contact tracing, is the responsibility of the individual to quarantine and to isolate. And that's becoming a significant challenge in our community. We know there are individuals out in the community who are infectious and are continuing to work, continuing to socialize, continuing to gather with those who are vaccinated and unvaccinated. We are starting to see infants in our community who are testing positive. That's a new trend that's beginning and very concerning for us and in other places. We are testing, we're continuing to test, but test does not replace vaccination, and we will not make that our highest priority. We're supporting the hospitals in a joint operation so that they can respond to those who are truly sick and injured or seriously ill. We do have a supply chain shortage now when it comes to testing. And there are two types of tests. One is to test those who are symptomatic, and another is to test those who are asymptomatic. Testing is no longer used as a screening strategy. There are not the supplies to support that. And they don't work, actually. The PCR test is for those who are asymptomatic, and as of August 23rd, we will no longer have the supplies to do that. They are back ordered. And again, we are not alone in that situation. So we continue to remind the public to get vaccinated, but we will not be doing testing purely for screening purposes. And then there is the rapid test, which we will continue to do. We're continuing to host 2 events a week, one in Seaside, one in Astoria. In fact, one is going on today. It's by appointment only. And we are working with Providence as well as Columbia Memorial Hospital in a joint operation to stand up an ongoing centralized testing site, and hoping that will be ready to launch and activate within the next 2 weeks. And that will be 5 days a week, a drive-through testing site. I think that's it for me right now, and I'm happy to answer any questions when we get back to that. Thank you.
Okay, thanks, Margot. And next, Judy, if you want to have any opening remarks, just give your name and title for the folks out there.
Judy Geiger, I'm the Vice President of Patient Care Services here at Columbia Memorial Hospital. And I would echo what Margot just said. We probably don't need to talk specific numbers because they change on a daily basis. But what I could say is that we've had higher volumes of hospitalized patients currently and in maybe the past week than we've seen throughout the whole pandemic. Patients with who are positive for COVID. We've actually had to stop our elective surgical cases here at the hospital, and we turned our same-day surgery unit into a COVID unit to house all of the patients that we're seeing with COVID. We're seeing patients that are younger and sicker than they've been throughout the rest of the pandemic as well. Our ED is seeing record volumes of patients. We're at a much higher capacity than we've ever been historically on a daily basis, with patients showing up in the emergency department. And a lot of them are coming in with COVID symptoms and are turning out to be COVID positive. The majority, I would say the vast majority of the patients that we're hospitalizing are unvaccinated for COVID. Part of our other concern just about this whole surge of the pandemic is that we aren't able to transfer patients out of our facility who are sicker than what we would typically care for, because all the hospitals in Portland are full and are unable to take our requests for transfer to a higher level of care. And that's not just COVID patients, that's all patients. That's patients who have significant trauma. It's patients who have had a stroke or a heart attack who need a higher level of care. And we're having extreme difficulty in transferring those patients away. And then I would also echo what Margot said, we're starting to become concerned about our testing supplies for COVID. And again, I'd be happy to answer questions as well.
Okay, thank you, Judy. And Jason, if you'd like to give some remarks.
Sure, thank you. Yeah, Jason Plamondon here, Chief Nurse Officer at Seaside Hospital, and really just want to thank Margot for what she shared and Judy. And really, we're here to let people know, like most hospitals across the state, our emergency department continues to see a high volume of patients. And many of these patients are seeking COVID-19 testing. Emergency rooms and urgent care should not be considered a primary source for patients requesting testing and should only be used during an emergency. The community can help us lessen this demand by first off vaccinating, and then second off scheduling appointments. I guess the big message I want to get across is the emergency room is not the place to go to get tested for COVID. Neither are our walk-in centers. We're just inundated with patients. I think there's some fear now in what they're seeing, and we're even seeing people who are asymptomatic who are just scared and want to know whether or not they have COVID. And I appreciate their fear and their concern, but I think that doesn't help us where we're already overwhelmed. So we're here with Margot and with Judy kind of as a unified front to implore the community to get vaccinated. Wear your masks, social distance, and then there are other alternatives for testing that don't require you to go to the ER. I think that's the biggest message I'd like to get across today with this group. And I'm open to questions also. Thank you.
Okay, thank you, Jason. All right, we will open it up to questions now. I'll call on the folks who are here to ask your questions, and we'll go in, I guess, alphabetical order just to make it easier. If you have a follow-up question that's immediately related to your first question, you can go ahead and ask that. But otherwise, we ask that we just kind of go in turn so everyone has an opportunity to get their questions answered. So go ahead and when I call on you, identify yourself and what organization you're from, and go ahead and ask your question. So Griffin Riley, if you have a question, go ahead.
Yeah, Griffin Riley. I'm a reporter over at The Historian. I guess, and I apologize in advance if this has been kind of like, repeated a lot in press releases and individual times I've talked with you all. But right now, if I wanted to get a test right now, let's say I'm asymptomatic, what is the just like the first person I call, and then like the steps following that?
You want me to answer that, Tom?
Sure, if you want to go ahead.
Yeah, so that is a question. So there's a couple, but actually 2 or 3 different things you can do. Throughout the pandemic, the county has maintained a public information call center, and it is staffed from 9 to 5, Monday through Friday, to answer those questions. What can people do and where can they go? And we update that information routinely. So that's the first, and that number has not changed. It's 325-8500. Secondly, in this joint operation around testing and supporting the community, we've developed a couple infographics which are becoming publicly distributed, and perhaps Nancy, you might want to speak to this as well. And it really provides guidance about whether or not you should get tested, whether you're vaccinated or not vaccinated, as well as if you have symptoms presenting, how to make the right decision at the right time for the right reason. And so when someone just wants to get tested for screening, our response at this point in time is to ask more questions and refer them to the public information call center that's here to support our healthcare partners in the community, as well the community at large. Because if it is getting screening because they don't want to get vaccinated, and it's required by employer, that is its own set of questions. And we could spend probably the next 45 minutes talking about that, which we won't use this time for. We're not recommending screening. If you're vaccinated and you've been exposed to a positive case, the guidance is still to quarantine. If you develop symptoms, you can get tested, because we can identify whether or not you're positive or negative with a rapid test. If you're asymptomatic, we're not going to be able to test you, and you should be quarantining if you're unvaccinated. If you develop severe symptoms, then you should be evaluated. So the screening piece of it is going to be fading away because we simply do not have the supplies, and it's not the highest priority at this point in time. People are better off getting vaccinated and having more protection than using routine screening testing to determine whether or not they're positive. And in fact, if they're positive, they were likely already infecting other people during their infectious period.
Right. If I could just follow up really quick, the testing shortage or supply shortage, is that something that you're seeing maybe being experienced on a state level outside of this particular region?
Yes. So we're all asking for the same supplies, and some of our supplies come from the federal government through the Oregon Health Authority, and so it's back ordered. Not rapid tests, but the PCR testing that we use for asymptomatic individuals is absolutely back ordered, and I'm sure, like many things, will be prioritized.
Okay. Unless Judy or Jason had anything to add to that? No? Okay. Looks like Joanne Rideout. If you have a question, go ahead.
Yes, thanks, Tom. Can you hear me? I was worried about my mic before. Okay. I had a question probably for Margot about just the skyrocketing number of cases here in Clatsop County. Before, in the pandemic earlier, Clatsop was one of the had low numbers compared to other counties in the state, and now we're really high, and the state is really high, and we seem to have it under control before. And so people probably would have questions about why so many cases now. So that's generally my question.
So why so many cases now? It's really twofold. And then it's that balance between the system supporting containment as well as individual personal responsibility. So Oregon opened up on June 30th to great fanfare and celebration, right? Everyone was excited and the opportunity to start gathering again, including large events, right? And even though they're outdoors, they may be very crowded, but people are unmasked. So it was a perfect opportunity for the transmission. And it just so happened that the Delta variant sort of happened simultaneously and started visiting Oregon and moving across Oregon with greater speed and transmissibility during that time. So the two of those together converged and really have contributed to, partially contributed to the current situation. Then we look at personal choice and responsibility. There are segments of the population or individuals for a variety of reasons who have chosen not to be vaccinated. So they're still very vulnerable, more vulnerable to getting COVID. The masking mandate went away, and we know the masking was a significant physical barrier to transmission. Reinstating that has been challenging because there are those who are just simply not willing or wanting to wear a mask. As you know, the county implemented a mask mandate a couple weeks ago prior to the governor's statewide indoor mask mandate. And so there's, and then there are those individuals, honestly, and segments of the population, and it may be even family members that don't want to be vaccinated, may or may not really believe that in the severity of the pandemic and what's going on right now. And then people have fatigue, they have pandemic fatigue, and without historical context, there's a lack of appreciation for the fact that Clatsop County, as well as many other communities, have experienced communicable disease outbreaks, whether it was polio, measles, diphtheria, tuberculosis. Certainly we reference the pandemic of 1918, but Clatsop County has been affected by many outbreaks affecting the population in the past, and unvaccinated population. But the response was different then than it is now, because there was this collective sense of vulnerability. And so it's there's many variables, Joanne, that have contributed to this. And then the fact that the community, the economy is opened back up, employers need their employees to work. There are employers who may not be supportive of vaccination, even though we've committed and continue to commit for the last 2 months that we will visit any employer who wants to stand up a vaccination event for their employees, no matter what time it is, to accommodate their needs. And we've had 2 requests since we've launched that initiative, and that was about 2 months ago. And I just want to give you one example, because this isn't a unique example, and it can be in a daycare setting, a childcare setting. So you have an employee who is unvaccinated, who is going to work and becomes symptomatic and tests positive for COVID. They have then exposed those children who may be in that cohort that they're supervising to COVID. So now those children need to quarantine, and maybe others, depending upon the design and how the children are cohorted in that setting. So now those children need to quarantine. Because they need to quarantine, they need caregivers to then take care of them at home to quarantine, which then means those are parents or caregivers who may not be able to go to work, which then infects the employer. And so it's a domino effect. It's not just about what one person does or doesn't want to do. And when you have that many sectors affected by a single case, it contributes to the current situation that we have.
Okay, thank you.
Judy or Jason, did you have anything to add?
No, Margot did a great job. Thank you.
Okay. I might just clarify, Margot mentioned the county implementing a face mask mandate, and just to clarify, that was on people coming to county facilities, not not countywide. So, okay, we have
Thank you.
someone on who's just identified as caller 0. I don't know if that's our caller from KAST. Do we have someone from CAST with us today? I guess not. Okay, Griffin, do you have any other questions?
Yeah, I did. Two questions. I'll just go. The first one is, I've asked this before. I know from Derek here that, you know, back in May in the spring, there was more like public demographics released specific to each cases as they come out. You know, gender, location, etc. I've kind of, in covering this and what I've heard from other people, it's hard to kind of keep track of the cases more than just a number, or outbreaks more than just a number. And you know, it's maybe just my personal opinion that it can be kind of hard to gauge just the, you know, the depth or the severity of those numbers when there's not as much context placed behind them. Is there going to be a return to tracking and reporting those demographics in the near future?
That's a great question. Thank you for asking that, because you asked that previously. So I made the executive decision to move away from doing the direct, the daily accounting. So there's a very practical reason. There are way too many cases now at this point in time to provide that level of detailed information on a daily basis. In fact, there are too many cases that it's becoming challenging for us now to even be able to report all the positive cases, right? How many of those are vaccinated and unvaccinated? Because the database systems aren't synced, so we're actually individually having to go in to a database system that is very overwhelmed right now at the state level and extract that information. So we can report it in generalities, but that is even becoming more challenging, honestly. And so when you have 12 or 15 cases or these little spikes, it's much easier to report that information. But we have so much cumulative data at this point in time that while it may to some seem like that's valuable, I think what's most important and most indicative of the severity of the situation is actually the trends, which is what we are reporting in those aggregate numbers. We may go back to reporting on a daily basis the number of cases that, you know, of positive electronic lab reports that we received yesterday, and we could report that by zip code. But the OHA dashboards are very comprehensive and detailed, and in fact, I go to the dashboards often for data and check them daily. And while they may sometimes lag 24 hours behind or 48 hours behind, it's because there's so much data, and they're also cleaning that data to make sure the numbers that are posted are accurate. I will share with you that I think it's Thursday or Friday of this week or the beginning of next week, there is going to be a new dashboard, and I'm really looking forward to this, but it's very bittersweet, is a dashboard dedicated to the pediatric population, and it will also have county-specific data. So I think we're doing our best to meet all the needs, providing, again, you know, the positive cases, but there are just too many cases at this point to provide that detailed information that we did in the past.
Right. And you said that was an OHA dashboard that was going to be new? Sorry.
Yes, it is an OHA dashboard specifically for the pediatric population.
Jason, Judy, any additions to that? Okay.
This is Judy. The only thing maybe I would say is that this surge that we're experiencing right now really does feel different to those of us at the front line than the other surges did. We did such great preparation. We've been doing it all along, but then just this last few weeks has been incredibly difficult in the hospitals.
It's very concerning, and to follow up what Judy's saying, we are seeing a difference in the symptom presentation, right? Early on in the pandemic, it was most of the positive cases were actually asymptomatic, right? And then we saw the horror stories of those who got really sick, and kind of the demographics and the comorbidity of that population. And then we have these, obviously the variant strains. But what we're seeing now is a more common presentation of truly flu-like symptoms. The headache, the fever, the body ache, the respiratory, it's mirroring much more like the flu. And as Judy mentioned, it is younger populations, right? And so it's very concerning. It's very, very concerning right now, especially because here we are and we've done all this preparation and we know so much more. And so this is where we are and what's happening, what's to come. And so how do we balance that with that desire to get on with life as we once knew it? And, really harnessing ourselves to take that personal individual responsibility to help quell the spread of this to the best of our ability.
Okay. Joanne, your question.
No, I'm fine. I don't need to ask any more questions.
Oh, okay. I
Yeah.
guess it's, I'll go back. Do we have anyone from KEST with us? Okay, I guess we don't. Griffin, if you have any other questions, go ahead.
I did, and I don't know. I don't know if I can expect like a really specific answer on this. I'm sorry in advance again, but and this could be to anyone who can answer it. But has there been any talk of vaccination mandates at schools or at hospitals, like at Columbia Memorial Hospital specifically, among employees?
Well, I've been talking a lot, so I do have a response to that, but I'm going to defer to my hospital colleagues to go first on this one.
Jason, do you want to go first?
Well, the Oregon Health Authority, Governor Brown has sent out some messaging, and essentially what it says is Oregon healthcare employees will need to either A, be vaccinated, or B, show declination, that they've declined the vaccination, I think by September. And then those that have declined will be tested. Employees that have declined will need to be tested once a week. So Judy or Margot, does that sound accurate?
That's our
Yes.
understanding.
Yeah. So that's where we're at with that.
Is that, can I ask, is that once a week testing? Do you deem that sufficient?
I'm going to say that we're going to follow what we've been asked to do.
I'm comfortable responding to that. Go ahead, Judy.
No, I'll let you respond. I'll probably disagree.
Right, because we're getting a lot of calls on this. So it's not sufficient. People need to get vaccinated. It's not sufficient because you can test negative one day, because with every communicable disease, we have a transmissibility period, a window, and then we have the incubation period, right? So it could be incubating and then you become infected because there's a high enough viral load, and then the next day you test positive. But then 48 hours prior to that, you could have been infectious. So I think what it's intended to be is a reasonable compromise, but certainly not the best strategy. And I want to emphasize, because we're getting calls from individuals, how do we implement a testing system? Where do we get supplies? Oh, public health will do it. Public health is not going to be doing the routine screening for employers, for employees who do not want to be vaccinated. That is not our highest priority. We have the best strategy, which is to get vaccinated. We can provide education. We have, our events, but as I said, we have a supply chain shortage. And so the screening that is being recommended requires PCR. And as I just said earlier in this conversation, we have a supply chain issue and we're not able to do that type of testing. So it is a quandary. And I will say we've had some people that are not happy, but they are choosing now to get vaccinated.
Right. And
I think it is challenging for all of us too, because it puts additional burden on an already stressed system at the hospitals as well now to have to test our handful of people who are choosing not to be vaccinated.
yeah, I was going to ask, is there a noticeable population among employees that are declining vaccination at CMH or elsewhere?
They don't wear a badge or anything that says I'm unvaccinated, so nope. But we are collecting the declinations
Okay.
of all of our employees.
And I think while the numbers are concerning, right? You know, I think all it takes is one person who's infectious to create a problem that affects many. And so, you know, while, you know, it's better to have 3 who are unvaccinated than 5 or 10 or 15 or 20 who are not vaccinated, having one, it still poses a challenge. And of course, there are truly exceptions for not being able to get vaccinated, even in school-age children with routine vaccinations. But it's a challenge.
And I think for us that it creates an additional workforce shortage if we have someone who's unvaccinated who then exposes other employees to the illness and they have to be quarantined and out of work for a while. It just increases the stress on our system because then we're more short-staffed than we were to begin with.
I think another, you know, it's that, you know, those who are vaccinated have the ability and the right to ask when they're seeking care in particular places or they're seeking any kind of service. It could be getting your hair cut, right? It could be going and getting a massage. It could be going to your primary care home. To ask the question, because we forget we ask these questions all the time in other situations, right? We go, oh, there's smoking in that place. I don't want to be in a place that has smoking, so I don't go in, right? To say, are your staff vaccinated, right? And the employer doesn't have, is under no obligation to answer that question or to certainly provide that information of who is and is not vaccinated. But there's nothing preventing the consumer from asking the question. I know I've asked that question. Absolutely.
I have another question, Tom, when I can have a turn.
Yeah, go ahead, Joanne.
This is a question for the hospital folks. Judy, you said earlier that this pandemic feels different, and we've sort of been hearing that in more populated areas of the state, hospitals are filling up. How close are hospitals here to simply not having enough beds for the load of patients that are coming to you?
It's a great question. You know, we've had to open an extra unit because in addition to COVID, we've seen a lot of other patients in our hospital. And then, you know, now we've had to close down our surgical services. So we're not doing any elective surgeries either right at the moment because we're pretty close to that line of being too full to be able to care for people safely. So we're pretty full. We've been completely full. We've been over capacity in the last couple of weeks.
Wow.
So this is Jason. You know, we've been, knock on wood, we've been okay, but we're seeing a much bigger surge in our ER than we've seen in a long time. And there have been days where we've been very close to overspilling. We have a extra unit that we've prepped in anticipation of overflow. Because like Judy said, you know, we're part of the Providence system, but we can't, we're we're beyond that ability to move patients as easily as we were prior to this outbreak. So transferring patients has become more difficult, and as Portland fills up, then that backfills us. So we have, we're prepped and ready to go for that surge. It would be, not ideal, but we have a plan. But it's concerning. It's concerning if if this spike continues as we expect it to. It's going to get complicated.
Okay, thank you both.
And we've all heard that the projection is to be 500 hospital beds short by the first part of September here in the state, and that's especially concerning to those of us out here because, as Jason said, it backfills us, and then it's patients that really truly could use a higher level of care than you can get in a local, rural, critical access hospital, and they just can't move forward to the care that they really need to receive.
Wow.
I think that's the important message the reason we're getting together is because for critical access hospitals, it doesn't take much for a tipping point. You know what I mean? The bigger hospitals have more wiggle room, I guess is what I'm trying to say. And so if we anticipate seeing the spike that we're going to, we've got to be ready for that.
Wow, thank you.
Any other questions from our reporters?
I think that could be it from me for now.
Me too. Thank you.
All right. Well, we appreciate you taking part and hope we've answered your questions. And thank all of our Margot, Judy, and Jason for taking time out of their very busy schedules too. So.
Hey, Tom.
Oh, go ahead. Yeah, go ahead.
Sorry, I realize this is being recorded, so I messed that up. I would, if it's all right, you haven't asked about vaccinations going forward and booster doses. And so if you're interested, I could provide you with a very brief update on that.
That'd be great.
Okay, super. So our standing orders just came from the Oregon Health Authority yesterday regarding providing a third booster dose of Moderna or Pfizer to the immunocompromised. The county's vaccine task force that has been intact and responding to the pandemic for many, many, many months continues to meet. In fact, we had a meeting this morning. And so we're working out how we're going to support vaccinating and providing boosters to those who meet the very, very specific criteria. So this isn't anyone who says, I'm immunocompromised, and so therefore I'm eligible for a booster. There is going to be an attestation process. And I think at least the takeaway this morning, although again, this is very possibly could change because we're waiting for a little bit more information, that this first wave in population of individuals who are eligible will be vaccinated by their primary care homes and by scheduling an appointment at public health. We are vaccinating for COVID 4 days a week at our clinic. So that's what I can tell you about the immunocompromised. Literally, we don't even have the signed standing orders yet from our health officer, but that's what we're looking at. And then it looks like in September into October, the general population, not all, depending upon when they got their second dose, will be eligible for a booster dose. And so many in the community are familiar with our large vaccination clinics that we've been standing up in North County and South County on a weekly basis, sometimes twice or 3 times a week. That process is going to remain intact, and we will stand up vaccination opportunities for that booster dose. It's not as simple as somebody just walking in. So there will be a scheduling process as we've had in the past. I don't have any more details because, again, I'm aware of this. I haven't even had time to read the most recent release that's come out. But we will have answers to any questions at our public information call center. And again, Tom can share that with all of you as well.
Right. Thank you. Yeah, I didn't want to ask that question because I didn't want to get too off topic, but I appreciate that.
Mm-hmm.
It's all connected.
Yes, it is.
Anything else from Jason or Judy?
No, I just appreciate having this time to help with this message.
Great.
Thank you.
I guess if I could ask one more question, this is Joanne. Is there any sense of how bad this could get? I mean, it seems pretty bad now. I mean, how much worse could this get in terms of case numbers? And do you have any idea, or is it all just we're figuring it out as we go?
No, OHSU has released very good projection modeling, and the data, the numbers that Judy cited, I think maybe come from that or are aligned with that in terms of projecting out what we expect. And if the trend continues, it's going to get much worse probably until mid-September. The reality with communicable diseases, at least with this variant, right, is that, and the way viruses work is they need a host and they need a vector, right? So it's going to continue to transmit until it no longer has someone to transmit to, right? And so what's happening is we're seeing it transmit through the vaccine because we know it's not 100% protective. And that people are developing symptoms, but they are truly milder symptoms. So it's sort of, I was talking to a fire chief, not a local fire chief, but somebody who's done big California fires. And I said, I feel like we're in the middle of a wildfire right now. And I don't do fires, I just know the language from the news. And I said, we're beyond containment. We're beyond really managing it to a certain extent. So we're identifying what's most vulnerable, right, in the population, identifying what our needs are, how the hospital can support, what we can do on the front end. And then some of it's just going to take its course, right? And it's not just us, we're seeing this in many, many places. And, you know, the fire chief said that's kind of exactly what it's like with fires. And then there's a point when they do evacuations where it's sort of the last call, either you evacuate or you don't, but we're not coming back again. And that's not our strategy. We're all here and we've taken an oath to serve the public and we will continue doing so, you know, in the very long hours that we're working. But what we do know is that if people get vaccinated, it is the #1 strategy. And so we're just going to keep asking for that and asking people to get vaccinated and keep educating. And hopefully we won't see a worse evolution of what we're currently seeing, but we don't know and we're expecting it to get worse till about mid-September. The long answer, but it's complicated. There's not a simple answer. It's all connected.
Thank you.
Yeah. All right. Anyone else? Anything from anyone else? Okay. Appreciate.
Thank you all, and thank all the volunteers that continue to help us.
Yeah, we will be putting out a call for volunteers too, so we'll be sending that your way too. So anyway, thank you for everyone for taking part.
Thank you.
Thanks everyone. Have a good day.
Thank you so much.
Thank you. Bye.